So I'm joined today by Ella Hughes. Ella is currently head of sports science at the Portland Thorns, and she leads the integrating the athlete monitoring, performance technology systems in a professional football environment, and is passionate about bridging research, data, and real-world application to inform product development, performance, and athlete-centered solutions. And Ella has recently had a very interesting and I would say successful case study in postpartum return to training with Sophia Wilson. And we are lucky enough today then that Ella is going to share that case study with us, talk about what she's learned through that process as a sports science practitioner, and talking and sharing about what we do know in that time period, but also critically what we don't know yet about postpartum returning to training and playing, because obviously it is relatively new area of interest and attention, but a critical one. So Ella, thank you very much. And I will hand over to you now to present your case study with us.
Thank you so much, Joe, for having me here to chat about this. Obviously, this is something that's just so important to me. And I've had the privilege in my time at the Thorns to be around some incredible women that have helped me develop this case study in and around pregnancy and postpartum training. I think probably the first thing that I usually get asked is, what's the relevance of this? Why am I chatting to you guys about babies? And why is this so important? And really, it's because now these women can. For so many years, a lot of these athletes have had to make the choice between their desire to start a family and their career. And obviously, there's been some incredible pioneers, some of those that are on the screen today, that have led the way in carving the path for a lot of these up and coming players to be able to make that choice a lot more easily. So we now have over 100 women who have had children return to the professional stage, and 10 players and counting on the US national team alone have had children and then returned to their US national team. And this has obviously been fantastically supported by initially FIFA on maternity regulations in 2021 with granting minimum maternity leave. And then they've obviously continued to build out programs and pathways for more of these women. And the NWSL here in the US also granting parental leave, child support, and then also roster protection. So allowing these women to have their babies and then come back and try out for their roster spot again in the following season. This is so important because we need to be ready. This is only going to increase. When I originally wrote this a few weeks ago, currently 10 players in the NWSL are pregnant or on maternity leave. That number has since increased. We have to be ready to put things in place to support these women on another part of their professional career. So when these athletes are in our environment, we have a systematic approach for all of it. If that's an injury, if that's mental health support, if that's nutritional support, all of that has a systematic approach to it. But pregnancy didn't have one because, again, this hasn't happened very often. And so for me, it was treating it the same way as anything else that we would do for these athletes in the same standard. And so putting them, obviously, the mum in the center and then fixing the different things around that need to be there in order to support them, and us working in a group with it. To know the how, you need to understand the what. And again, that's the same way in which we would treat anything for us. So for us, looking at that, most organizations and players do not have the sufficient resources or understanding of how to provide the best possible chance for, number one, and most importantly, a healthy pregnancy. Number two, successful recovery postpartum, and then the ability to return at the highest level. And I highlight players here because a lot of the times the onus is put on the mum to understand. I have 2 little boys myself. Looking back on my first pregnancy, I was expected to know what was happening to my body, and I had no idea what was happening to me. Now, having had the perspective and the ability to dive deeper into this for obviously these players, and the onus can't be on the mum. We wouldn't do that with anything else within our environment. We wouldn't expect them to understand their strength programs or the on-field loading or periodization. We do that for them as the experts. So we have to be the experts here. So then the first what being, what are the demands of the women's game? Next one being, then what are the demands of pregnancy and postpartum? And both of those seem very simple in terms of the question, but actually we don't have a lot of those answers yet. And then what does the pathway to return look like? So having had both of those, then what do we do to get these women back to what they want to do? So the first what are the demands of the NWSL? We don't know enough yet. It's my job every single day to periodize out what these players need on the pitch, off the pitch, looking at all the different elements, things that we collect on them. And I still can't tell you what the exact perfect system is. Obviously, historically, most of this research hasn't been done on women. And so a lot of the times we're referencing stuff that has been done on men many years ago. And so for us, utilization of individual profiles is absolutely key. I need to know exactly what each player is going to be doing. And so when we're looking at Soph, first referencing, okay, what are Soph's game demands? What is she going to be asked to do on the pitch when she comes back? In terms of just some really high level metrics here, her total distance, high speed sprint, maximal speed, her accels and her decels in those higher zones, that 3 meters per second. But then also the other side to that, like what are her weekly demands? So what is actually her training demands, and looking at like how do we prep her to be able to chronically sustain that as she comes back from postpartum? So looking at this, we made sure that every time we reference her individual profile. The next what are the demands of pregnancy? Seems very, very simple, right? But also in really delving into this and being able to ask any question that was asked of me by these athletes, one of the first things is blood volume. It's going to increase by 50% by the end of that third trimester. So resting heart rate in return is going to go up to about 20 beats per minute. All of that then equates to increased respiratory demands because of that larger blood volume. But you also now have a watermelon that is pushing up your diaphragm, especially in that third trimester. And so actually increasing that lung space and being able to feel comfortable breathing is really, really, really hard. And so if you can put that into context for these athletes as we look through their pregnancy, it's going to help them. And also their musculoskeletal shift. For these players, their center of gravity, where they are in space, is huge for them. It's how they move, it's how they react to things. And feeling really comfortable there is important. And now all of that is different. Everything about that is different in how their pelvis is adjusting to prepare for birth, in terms of the extra weight they're carrying from baby, all of those things. And so when we're still training them through pregnancy, finding ways to make them feel comfortable with that change is massive. And then obviously because of all of this, our metabolic demands are up. So we have an increased caloric need of 300 to 500 kcals a day by the end of their pregnancy. And bear in mind, this is just to meet basic living. So that is just growing the human being, not adding the fact that if they're fortunate enough to, they're also then going to continue to train as the athlete they are, which then requires obviously even more caloric demand. And what we see a lot is actually underfueling in pregnancy and postpartum. So making that really, really clear and laying out guidelines that can help them and understand that is massive. And then also they're trying to figure out how to be an athlete. What is a pregnant athlete? There's a lot of stuff online that can sometimes make it look like one thing, but then they feel very different. And so framing that for them on how they still feel like an athlete with those demands of pregnancy. And then the biggest thing I always say, the little things count. Keep running, keep lifting, find time for sleep, which is an impossibility, maximize recovery, and then mentally adjusting to the fact that they're going to be a mom. So then we looked at, okay, well, how do we do this for training in pregnancy? So one of probably the most impactful conversations I had with an athlete was when we were sitting down to look at her plan. She was scared. She said, I'm scared I'm going to hurt the baby. I don't want to jump. I don't want to run. I don't want to move in a way that feels like this because I'm worried that I'm not doing the right thing by the baby. And reflecting also back on my journey, that was really profound because I remember very distinctively in my first pregnancy, back squatting and feeling very strong and very, very great in my second trimester. And I sent a video actually to my dad. And the first response from him was, whoa, 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 what are you doing? And actually, it was the education and understanding of I'm actually doing the best thing for me because I'm keeping myself healthy and moving in a way that I've been doing before pregnancy and continuing throughout. And then looking into actually some of the research of why this is supported, especially working with these athletes, like they're highly, highly, highly intelligent on the why. They want to understand what's happening with them. Everything is around their careers, around their body. And so having the research to back that up. Some of the most recent things being published by some incredibly smart people out there, which I'll reference as well in a little bit, show that strength training actually has a 58% decrease in gestational hypertension, a 38% decrease in gestational diabetes, and a 52% decrease in perinatal mood disorders. So just that in and of itself is just such a fantastic motivation to continue moving in a way that fits them and fits their pregnancy, and knowing the benefits that they're going to give to themselves and to baby. And then also what's I think a lot of the time is they say pregnancy is going to equal injury. Pregnancy and then postpartum equals injury. But actually, if we look that a reduction of 50% or more in the first and second trimester of training volume increased the risk of postpartum injury by 189%. So it's not the pregnancy itself. It's actually like finding ways to continue to feed their body what they need as the athlete that they are, that's going to reduce their chance of injury. And then probably one of my most favorite readings that I came across was actually looking at their conditioning, so VO2 max. So looking from baseline post baby, we actually saw that their VO2 max remained elevated from 12 to 20 weeks and persisted at 36 to 34 weeks postpartum. So this suggests that pregnancy actually induces long-lasting cardiovascular adaptations. And so if you want to be able to increase your VO2 max, just have a baby. And so I think that this is a really fantastic way to show what also women go through in that adaptation process through the demands of pregnancy, and how actually their body is responding and elevating their ability to do things through it. And so I'd mentioned very briefly some of the fantastic things being published out there. So Emma was just a fantastic support for me. She's doing some incredible stuff in England, and her work through pelvic health and women health and advocacy in women's soccer. And then FIFA, obviously, in conjunction with that, with Margie Davenport, have actually done an evidence-informed stay and play applied guidance for pregnancy. I encourage everybody to go look at this. Some of the things in there are just fantastic. So then we looked at, okay, if we're treating this in the same systematic approach that we do everything else, monitoring is a part of that. We monitor everything to do with the athlete during the day, from their wellness, their RPE, and then also their testing. And then just because that athlete is pregnant, we don't want to take that element away, because understanding what they're actually going through and their changes helps us periodize and program that better. So when we think about monitoring during pregnancy, first thing has to be player-led with really realistic expectations. So obviously when we're testing post-injury, and I use that word very lightly because pregnancy is not an injury, but when we testing post-injury, we have this projection of this linear increase, right? Things are going to progressively increase and get better. Pregnancy is essentially going to show the opposite of that, just because of the demands. Some women are the fabulous exception to that rule, and that's amazing. But we want to make sure that they understand that they're not failing when the scores don't meet what they had been. And when they sometimes see those scores progressively decrease in strength and power, that's okay, because we've explained the why of what their body's going through and the why of what it's adapting to. And so for us, we kind of had a framework of what that looked like across the 3 trimesters. So first trimester, essentially everything stayed very similar for us. So our weekly check-in for readiness in our counter movement jump and single leg counter movement jump, looking at those same metrics, their eccentric duration, their peak power output, their jump height, just as an assessment of how are they coming into us this week. Their strength assessment stayed the same. So following the strength and conditioning blocks, so looking at retesting them every 4 to 5 weeks and making adjustments based on what we're seeing. We did make positional changes because obviously in that first trimester, we have all that estrogen and relaxin now coursing through our body, and this can make them feel very, very different. And sometimes those positions are uncomfortable. So we definitely made positional changes in some of our force frame testing on that. And then we would really emphasize pre and post testing fueling, because nausea and dizziness in that first trimester is high. And especially when we're asking them to do maximal testing, like if I'm asking them to do a seated knee extension, and it's a challenge because they want to go as hard as they possibly can, but that can also make them not feel very well. So making sure that they're fueling appropriately before and after. And then also we would take into account adjusting prone positions, because breast sensitivity and pain as well in that first trimester can be very high. So laying them on their stomach can not feel good. Into the second trimester, which is considered the best trimester for training. I say that lightly too, as someone that had no nice trimester through all of their pregnancies, but in the assumption that a lot of those initial hormone spikes have settled and they should feel a little bit more like themselves. The only real changes we made here was we would switch from long lever ABAD to short lever ABAD and IRER. Again, just the hips, just in terms of comfort for them, felt a lot better to move into those shorter positions. And then we really prioritized their warm-up reps. So usually we would do a 3-rep build before their test. On some of them, again, individualizing to each athlete, we would actually add in an extra 1 to 2 reps because it just felt better for them in terms of any testing, making sure they had their mobility as well prior to anything. And then on field, really looking for monitoring changes of gait. Gait in pregnancy is going to adjust, obviously, to make room for baby, and then as their pelvis is shifting. And so if we saw really, really big changes in gait that was inducing any uncomfort or pain, we would make adjustments there. Third trimester, this is where we're going to have to make most of those adjustments in monitoring. And so we actually made the decision to switch from our counter movement and our single leg counter movement check-ins to just counter movement, because the proprioception at that point in getting them to balance and actually remain still before initiating their jump was really hard. And again, in that thing of realistic expectations, making sure that they understood that that was okay. Build reps became absolutely critical. So we kind of started to do that in that second trimester, but now we really, really emphasize working at 10% build increments through their sets. We would make sure to emphasize maintaining their core. And I say core because people will say, well, third trimester, what core? We still have a core. Bracing and breathing and everything through there is so important. So we would focus on them activating and breathing through there versus compromising that position for maximal results. It was really key here to also make sure that the athletes knew, pending clearance from their OB or their doctor, whoever is overseeing their pregnancy, who also has final say on all of this, athletes can lay on their back for testing. Now, please don't lay an athlete down on their back and leave them there for 3 hours. That would absolutely be inappropriate. We use the ISO 30 test at the Thorns to check on their hamstrings. We did adjust the ISO 30 because at that point, the pressure of getting into that true position felt really uncomfortable. So we switched to a supine hip flexion, so them laying on their back there to still take a look. I do also want to note that prone testing, especially in that third trimester, but also feeds into the second trimester, is not appropriate. Laying a mom on her belly, one, makes them feel incredibly uncomfortable. It can be really painful. So try to switch to any position where they're laying on their back for their testing. And then we've done all of this. We've done all of this work, and we've been doing their strength and their field and their monitoring and adjusting to all these things. And then I think the phase that we typically skip over the most actually is birth. We kind of go, okay, that baby's here. But actually, the birth is one of the most critical parts for these mums. Every birth experience is so different. I've had a mum have a baby within 30 minutes that I've worked with, and I've had a mum have a baby within 4 days. And that changes dramatically their recovery postpartum. And so, in whatever way we can to feel really comfortable getting information from the athlete on their birth experience, what they need, how we can support, is going to really, really affect those first few weeks postpartum. So this was one part that we really tried to emphasize on, making sure we didn't just go, okay, baby's here now, but actually understanding this critical step in now their postpartum journey. So what does the pathway to return look like? So our next what? So for me, really, I have an initial 4 steps. So step 1 is to change the 9-month and the 6-week mindset. And that's because we say, well, we're pregnant for 9 months. It's actually 10 months, but there's so much more to that. If you're on a pregnancy journey that has included miscarriage, if you're on an IVF journey, if you're egg freezing, all of those things change that entire perspective of pregnancy and pre-pregnancy. And so understanding that 9 months is not the timeline for every single mom. And then the 6-week mindset. The mom may go in at 6 weeks to get clearance from their OB. Okay, we're ready to go. Most women aren't healed at 6 weeks. 6 weeks is just the initial beginning of their healing process. And so taking away the expectation that at 6 weeks they should feel fine in themselves and ready to go and ready to do everything really takes away all of that pressure. Step 2, understanding that so many factors affect timelines and adaptability is key. That's because, again, of what we touched on birth and pregnancy and training is going to adjust all of that. Sport is a pressure cooker. We work on timelines. We like timelines. We like to know, okay, this is going to be 6 weeks from here, and we periodize this out. And what is that going to look like? Kind of have to throw that out of the window in pregnancy, because not one pregnancy and postpartum is the same. So being willing to be adaptable and within your organization, setting expectations around that adaptability puts the mum first. Step 3, don't be afraid to admit that we don't know all the answers. I have done this now for five different mums, which has just been such a privilege for them to trust me with this journey. And I still don't know most of the answers. And it's admitting that also can make that comfortability with the athlete feel so much better, because they don't know either. And some of the women I know to before that are doing just some incredible research help me and guide me, but leaning into them and leaning into the basics of training and understanding and things like our monitoring, still continuing to monitor, still continuing to look at those same metrics really help. And then step 4, which is the understanding on this pathway across all of it, they still want to feel like me. They still want to feel like them as the athlete, me as who I was before. And if you can level set everything to reframe them around still being an athlete and not just being a mom, they are a mom athlete, that's going to help them on their progression postpartum. So then the big one, what does the pathway to return look like? So I just told you to be completely flexible and to not have any structure in there. And now I'm going to give you a structure. So I'm completely contradicting myself. And that's again because I'm going to give something where there isn't anything. And then we adjust off this. But having something to look at, reference, and then guide off is going to be so helpful. So phase 1 is that 0 to 6 weeks. That's the restore phase. We're healing from birth. We're refinding everything. Phase 2, 6 to 12 weeks, reactivate. Phase 3, 12 to 18 weeks, rebuild. And then phase 4 weeks, 18 weeks to 6 months is return. And again, to emphasize that for some women, phase 2 might be 4 months. For some women, phase 2 might be 3 weeks. There's just such a range in there, but having this as a baseline to work off. So in our postpartum overview, to kind of dive into those steps a little bit more, phase 1, and this we got to work on incredibly close, especially with So's postpartum with Emma. And so she was incredible in giving us some great information to feed off from there in that initial healing phase. So initial recovery, healing, scar management is critical. Giving gentle mobility activation programming, not overemphasizing core engagement in those early days. That's really, really hard as they adjust back to feeling their core. So not overemphasizing that and taking the pressure off there. Monitoring mental health, bladder health, bowel health. Nutritional and fluid plans are essential for recovery and support of breastfeeding if that's what your mum wants to do. And thinking about our MDT, looping in your nutritionist, that in that postpartum phase 2, so they're a part of that process. Encouraging an open relationship with the OB about any concerns, making sure, again, OB and doctor sit above everything we do, and having their feedback and their support is critical. Between 4 to 6 weeks, your athlete should go for their initial pelvic floor exam as long as bleeding has fully stopped. That's really helpful as an initial baseline resource. It would be fantastic if your athlete has been seeing their pelvic floor PT throughout their pregnancy. That's obviously an amazing resource to have. And we've had some fantastic ones that have worked with us at the Thorns, but they should continue that relationship postpartum for a while. They will then obviously begin those biweekly appointments. So here is just a little example of what we gave Soph in those first 2 weeks. This is the most simple, basic, gentle reactivation of everything. And part of it was, and then the progression 2 to 6 weeks in giving this, it actually wasn't in adherence to the program. The program itself isn't the most important part. It goes back to, again, them feeling like me and feeling like an athlete. We would give them these types of programs when they're with us, when they're not pregnant. And so making sure that they have something when all they're thinking about is baby and feeding and sleeping and feeding and sleeping, to actually hone them into like who they still are and giving them something that they don't have to mentally put a lot of energy into but can follow. Phase 2, 6 to 12 weeks. So this is when we can begin clearance to impact and then go into the low running, low level non-reactive plyos and lifting. So in this phase, keeping it simple. Simplicity is key here. Foundational work over specificity. They're relearning their body. They're reestablishing all of that. So stripping all the way back to the basics, at least for this first block, is going to build the base that allows them to progress onwards. It was also a 12-week marker for initial retesting assessment for us. So with Soph, we actually went out to Arizona. Really thankful to Vald, who helped support us in finding a clinic out there to be able to go and test her and take our time and work through that. And so we reran through all of our battery of tests. So utilizing our Nord board, our force frame, our force decks, everything that we look at within our Thorns environment to see, okay, well, where are we at now that we're about to begin some of those progressions? So got to work with Nick, who is a trainer in Arizona, who we are just so grateful for, who volunteered as tribute to work with Soph as her trainer through her time in Arizona postpartum. We went to the field to do some initial field testing reassessment with Soph, and part of that was her getting on a ball. And Nick, again, being the great guy that he is, said, yes, I'll get my touches in with Soph on that. So these are the tests that we ran through with Soph on her force frame, force decks, and Nord board. Again, just really, really, really simple looking through there. And this was Nick and Soph getting her first touches in postpartum on a ball, which was, really fantastic experience to be a part of. So phase 3, 12 to 18 weeks. This is when, after that first initial block, we begin controlled reactive plyos to all the different planes. We start to progress into nonlinear running exposures. So adding in some really gentle change of direction through that and then building that throughout the weeks. We start linear speed progressions, form focused. Again, we were able to do that so fantastically with Nick, and he worked brilliantly on Soph with that. We had clearance to begin to move from her foundational strength into her hypertrophy phase. We're naturally going to have some muscle atrophy, especially through that third trimester, and then also in postpartum. So now we need to rebuild that back. And so we start through that hypertrophy phase there, starting to begin that weekly counter movement jump testing again for fatigue. So looking and checking how are they responding to the new stimulus that we're giving them, with another full battery of tests that I showed you in that phase 2, again at 18 weeks for us. This is then a progression. This is a really, really simplified version of what we gave to Soph as well, of her feeling like I'm coming back to being the football player that I am. So what does the week look like? And being able to give that as stuff that then she's able to periodize that out, because we would do that within our environment too. So this gets her back into the flow of, on my first day, I've got my day 1 conditioning. And then my day 2, I've got my strength, and I've got my day 4 conditioning, non-impact, and I'm working with Nick. And then I have a field session on Thursday. And that just kind of shifted that mindset back into that football player within that environment. Phase 4, last one, 18 weeks to 6 months. So now going into reactive sport-specific plyos through all the different planes. So looking at moving like a football player, what are the demands she's going to see through them? We progressed into reactive and impact work, moving into team training, and then absolute linear speeds on and off the ball, because obviously she would see both. And then the true final strength phase is absolutely critical. And it's a step that's sometimes really hard to squeeze in, especially when they're starting to get into that team training. Well, now we're going to add a strength phase in, and we're going to induce some fatigue with that. Yes, but strength metrics are going to fluctuate up to 12 months postpartum. And so making sure that we, again, reemphasize that getting that final strength block in is going to be so critical to their healing. And then exploring the unknown. I said earlier on that I don't know all the things, and I'm learning every single day. And like Joe said, in reflection on this case study, I'm learning more and more the way as I look at it with fresher eyes. And then also as I start working with other moms, like exploring what that looks like for them. One really interesting thing, pre-pregnancy, looking at Soph, the max outputs for her. So in high-speed running at 19 kilometers an hour, pre-pregnancy, the max that she had outputted in a game was 671 meters. In sprint distance at 23 kilometers an hour, the max she'd done in a game was 300 meters. Postpartum, she's had a 20% increase in her high-speed running output and an 8% increase in her sprint distance output. And the first thing when I show this to people is they say, why? I don't know. I have theories, adaptations that she's gone through in pregnancy, having a really structured postpartum progression and emphasis on her strength and her speed work. I think that's played a big factor. I also think part of it is the joy that she gets from being a mum and the balance that that's brought to her life in being the amazing mum that she is. But I actually don't know the answer to that. And there's a lot smarter people than me that can hopefully help me figure this out as we see this with different mums and different things happening. But this is just one of the many amazing examples of exploring the differences there. Some final extra considerations, because they just mean a lot to me. Breastfeeding does not equal injury. I don't want to ever diminish any mom from choosing or not choosing to breastfeed for however little or long they want to. There is no research linking breastfeeding to injury. Again, one of the biggest things is actually underfueling for that journey. So instead of associating that as injury, think about how do we support within our team to make sure that they can do what they need to. Sleep is an ongoing battle. We're fortunate at the Thorns that we have Aura rings, and so we can monitor sleep and I can check in on how they're doing. But someone's pre-baby sleep is now a completely different system post-sleep. So again, how are we supporting that? Do they need extra magnesium, cherry, blue light glasses? Education on when we can get sleep and finding sleep is huge. The menstrual cycle, how we speak about this matters. And I think that Joe and I could both have an entirely different segment on this entire topic right here. But to say in postpartum, some women will get their menstrual cycle back straight away. Some women won't have a period for a year and a half. They may have two bleeds a month, really light bleeding, really heavy bleeding. And that is a stress when they're associating their menstrual cycle as an injury, which it is not. And so how we talk about this to our postpartum athletes in supporting them on their journey with finding their menstrual cycle, again, postpartum, how they want to do that really is going to impact them, because what we don't want is them then anticipating how they're moving on the field or in the gym because I'm bleeding again and it's really heavy and this is going to affect, and then that's actually changing more than actually their menstrual cycle itself. recovery is always compromised. They go from their full-time job as a football player to their other full-time job as a mum. And so finding ways in which we can be really strategic about their recovery. I've held many babies while players have got massages and treatment and everything else to allow them to do things they need to do is so important. Pelvic floor PT is essential. It's, again, we're so lucky to have that as a resource for us. Finding one for your athlete, one that they can trust and that feeds into your system and speaks your same language is going to help you massively. And then on that, the groin squeeze is not the pelvic floor. The pelvic floor is such a complex, dynamic thing. And just because an athlete does really, really well on some groin squeezing scores does not mean that their pelvic floor is healed or that they're not still having pain or pressure or other things that then make it really difficult for them to do what they need to do. And that's it.
Amazing. Ella, thank you for sharing all of that. Thank you to both Soph, of course, for her permission to share all of that so transparently, as well as all the other mum athletes you've worked with who I know you've made sure you sought their consent as well to share any examples or information from their journey. It's very inspiring. We know that athletes are amazing, and we know that mums are amazing. And the combination of it as well, I think, is just mind-blowing.
Yeah.
And no woman should feel like they have to choose between being an athlete and being a mum. And so as we're seeing women's sport very excitingly grow, expand, more professionalism, more involvement, more resources in the games, we need to make sure we're doing everything we can, I think, to support those journeys. And as you quite rightly said, we don't know everything. And it's case studies such as these, it's research such as Emma, who's a boss,
Yes.
and is the queen, I think.
Yes.
But
she is.
Emma needs help as well. So actually sharing these stories is really important. Some of the things that I've made notes on that jumped out on me is, just how individualized this is. So whilst you shared that framework, the time frames, as you highlighted, it's very individualized. And that's just your starting point, your line in the sand, but you have to adjust to every mum and every athlete in front of you, the same as we would do with any form of training load or training program.
Yep.
I wondered on that kind of theme, if we could dive a little bit deeper momentarily into then some of the monitoring data.
Yeah.
So you gave us a great overview of the monitoring that you're capturing during pregnancy, and then also the testing and monitoring that you're doing postpartum. Obviously, there's so much more to that. But I wondered if you could share a little bit in more detail about how you're actually using that information. And any kind of interesting trends that you might have seen, again, knowing that it's all very individualized as well.
Yeah. When we're looking at this data, we're not expecting to see improvements in terms of their strength outputs or their peak power, even how they're loading into it and their effectiveness there. Sometimes we do, especially in that first and second trimester, because athletes are competitive. No, pregnancy is not going to change me in this. Like, I'm going to continue. What we're really looking for is big separations in any asymmetries. So how is their body adjusting that? And then tailoring their program to that. So if we're seeing one side reduction in strength, let's say on that ankle plantar flexion, all of a sudden someone that's been shooting with their right side, and now we're seeing that strength decrease at a much higher rate than their left, adding in those extra repetitions within their strength programming to keep that asymmetry as close to that 15%. I would prefer closer to 10% as we can throughout the duration of their pregnancy. In general, I haven't actually seen a lot of that happen. Actually, what I've seen a lot of, which again is one of the most interesting parts, is a lot of the chronic issues that we've had things with athletes start to even up. And I think the reason in reflection on that, what I think happens is we have the time to be intentional. So much within our world, we are focused on, okay, we finished the game on Sunday. We got to get them in the best place possible for the game on sometimes Wednesday, sometimes next Sunday. And we're dealing with chronic stuff and we're managing. But in pregnancy, when that's taken away and that weekly pressure is taken away, and we go, okay, so we're still seeing this imbalance in the internal rotation here. And they're just much weaker on that right side in their mean force. Okay, what are we giving them 3, 4, 5 times a week now that we can to correct that issue? And they get to be so present with their body that actually I've seen a lot of the scores in terms of their symmetries improve across our testing battery, which is fantastic. The biggest where we start to see compensation is in their force plate data. how they're shifting through there, because it just becomes really foreign and uncomfortable for them. And so finding ways in which we can still introduce their plyos and their proprioceptive work, even down to like the simplicity of balancing on one leg with their eyes closed, still supported. So they're working on how they're feeling in space there. But that's what we're really using it for in terms of long term with them through their pregnancy.
Yeah, one of the words I kind of wrote down here in capitals was adaptation, because obviously that's what we're dealing with anyway with our athletes.
Yeah.
But then the fact that they're adapting, obviously, in pregnancy and post-pregnancy, and you're adding in this monitoring piece just to try to quantify that, to course correct, to see what those changes are, and the interventions as a response of that.
Yeah. And then it's, it's fantastic if we can get all the way up as close to birth as possible. It's not always feasible for every test, but if we can get all the way up to that with that information, I know where they were to understand what they're going to need after birth. Now, taking into account birth in and of itself and healing and recovery. But if I know where their scores are, like we would with any athlete that's new coming into our environment, if I have that understanding of them as a person before that, I can better program and periodize what they might need after in a way that's actually sustainable and is going to give them a better progression.
And amazing to see the increase in the on-pitch outputs.
Yeah.
If ever you needed more evidence that mums are amazing. That's it. But there may come a time where that drops and they regress to the mean. Another thing that I wrote down a few times that you touched on was about the language that we're using.
Yeah.
You're collecting a lot of information, you're seeing compensations, you're seeing changes. You sounded really intentional about how you then talk to the athlete as both an athlete and a mum.
Yep.
So what kind of advice do you have for practitioners with all of that in mind, really?
Yeah, I think understanding that the course is not going to be smooth across all elements in our postpartum screening and what we're looking at. And so some things that I've seen that have been very conflicting is that actually their scores on our force decks in terms of their power outputs and their ability to produce force look great, look fantastic, look even, look symmetrical, but they're still struggling to get up to speed. And we're still really, really struggling to get them into those zones by as much as, 15% below their pre-pregnancy max speed. And so how do we not panic at that? And how do we look at them in totality? Well, then are they moving appropriately? Have we looked at them in different ways? Are we utilizing things like a 1080 to look at actually how are they producing force throughout their sprint? And so to your point of just like not panicking the athlete that they're not perfect to what they were pre-pregnancy, because they're different. It's a different body. They're a different human being, and giving them the time they need to adjust and build into that, and looking at it with really open eyes of, okay, like how do we adjust to this? And how do we find ways to drip in what they might need to get them to that point?
Absolutely. And I think as you highlighted right at the beginning, like this is such a critical discussion in the women's game across, all sports. As more professionalism is coming in, obviously, as we said, it's only going to get greater. I appreciate the honesty, the vulnerability, the transparency with which you've shared all of this today. And that's exactly what we need on this topic, because we are hopefully learning rapidly, but there will be so many practitioners also watching this, either yet to work with a pregnant athlete or maybe currently working for the first time with pregnant athletes or postpartum athletes. So obviously, thank you for sharing all of this, and presumably open to more conversations or people reaching out in a similar situation.
Yeah, like please, if I can help at all, like I said, I probably won't have a specific answer for you, but even just a sounding board to chat through what we've seen to find the best solution for that mom would be amazing. It's not knowing everything right now, but the vulnerability to talk about it. A lot of these women, and especially young girls, stop playing or participating in sport because they don't want to talk about pelvic plane, the menstrual cycle, incontinence, things like that actually stop girls playing in sport. And what I don't want is mums to feel the same thing too, to feel like they can't return because they can't talk about the things that they're feeling differently about their body, because we can help. And we do have a standard for that across everything else, and we have to have it for pregnancy too.
Absolutely. Well, I will put below links to yourself, Ella, in case people want to discuss further. I'll put links to Emma's work and the FIFA initiative as well that Emma, Margie, Evie all worked on. Again, that's a similar thing with really useful guidelines, very practical, but of course a starting point because everyone's individual. But once again, Ella, thank you. Thanks to Soph, thanks to all your mum athletes for sharing that with all of us, and really, really appreciate you putting it out there into the world, and hopefully I have no doubt it will help others.
Thank you, Jo. Thank you for giving me a space to talk about this. Any excuse to talk about babies.
My pleasure.